Recently, with my involvement with another study, the doctors go over, I mean, it is a large packet of information that covers every side effect. I mean, they even cover the risks of drawing blood, you know, and they go over it in depth with you. So really, that was alleviated there. But again, concerns of location, where am I going for my study? How far will I travel? Because will you feel well enough, even on standard of care chemotherapy, driving yourself home and having to have people take you back and forth? That's why if you have access locally in a local community where you don't have to go that distance, that's excellent. Concerns about family members or cost and things of that nature.
We review their medical charts, we look at their risks to make sure they are healthy enough to meet the study, because we don't want to cause injury. You know, yes, we're trying to answer a question, but at the same time, we don't want to cause injury to the patient. So we have very stringent criteria to ensure that this patient will qualify for the study. We review their charts, we make sure they'll be available for follow-ups, because it's important if something happens, we should be able to reach them or have them come in for an assessment if necessary. So there are a lot of factors which we consider. We speak to the family to make sure they're also okay with it, because we need that support system. If they can't drive themselves into the for a clinic follow-up, we need to have contact with a caregiver or a family member. So we take all that into consideration before we enroll a patient.
Well, first of all, to be as educated as possible under the circumstance. A lot of patients are overwhelmed with the diagnosis. It's hard for a patient to go through this by themselves, no matter how educated they are or not. They need a group of family or friends to be there to listen to the information, to try to, or tape the conversation to hear it again. As they go through the different options of treatment, because there usually are choices as to how to move forward, from no treatment or limited treatment to standard treatments to a research trial. Philosophically, if there is uncertainty as to how best to attack this, I'm always in favor of a research clinical trial.
Communication is a large part of what I like to consider your own personal treatment plan. And by that, I mean the one that you need to sit down and develop and discuss with everybody in your support structure, your friends, your family, your spouse, your employer. And the first one starts off with communication is your treatment team. Okay, you're meeting all these new people. You need to get a spiral-bound notebook. I mean, start writing down names and phone numbers and making sure that if you get a question later on, you can write that question down. So when you come back to your next appointment, or if you have an opportunity to talk to them, you can ask them the question and get that question answered right then and there. And just remember that all these, and especially about terms, okay, all these new terms are going to be thrown at you, write them down. Ask your treatment team. Find out what these words are, because the more information you have, the better you're going to be able to handle, quite frankly, the anxiety that's going to sometimes come upon you. And you need to be able to have that information ready, communicate, talk to them, make sure you got that in place.
So any research study, the main focus point of the informed consent is making sure the participant understands what exactly is going on in the study. What's the length of the study? So that is very important for them to take into account before they even decide to participate in the study. And it's very helpful to have your support team there, your husband or other family members there, to make sure, like, are you asking all the questions? Because maybe they may have thought of something else that you didn't think about. So having that support team there is very important.